In any field, innovation comes from the bottom up. It comes from tinkerers and explorers that want to try a different way. Innovation never can be imposed from the top down. And one of the factors that's causing such a challenge to healthcare delivery in our nation today is that although there's been a lot of technology and a lot of other philosophy that's been coming out in the past 10 years, there's been no true innovation in the delivery of healthcare. I mean, you can fragment it with telehealth and urgent cares, but in the end, delivery of healthcare is primarily between the patient and their own personal clinician. And what happened back in 2008 is the Accountable Care Act specifically removed the physician from the healthcare innovation equation. Physicians' ability to participate in designing healthcare delivery systems was dramatically curtailed. And even the author of the Accountable Care Act admitted in the Wall Street Journal in 2016 that this was a grave error, that since the ACA has come into effect, they've seen a huge consolidation of healthcare providers into these healthcare delivery organizations and virtually no innovation. And he calls that the single biggest sin of healthcare reform. So innovation is going to depend on the ability of the regulatory bodies and on the courage of the healthcare delivery organizations and the clinicians to step out from the current compliance paradigm and really align financial incentives. Because I can tell you, based on my personal experience with my healthcare organizations, once those incentives were aligned, the sluice gates were open and innovative ideas just burst forth like a torrent. And each one delivered another one and another one and another one. The true exponential growth in value-based healthcare delivery is not the financial innovation. It's not the financial increase based on increased patient numbers and increased satisfaction. It's the innovation. The innovation is going to increase exponentially once all of your incentives are aligned. And that's the key. You have to have the courage and the conviction and the foresight to understand what's going to happen and then take the first step, align everybody's incentives, and then watch healthcare delivery innovation explode.